Hi, my name is Sun Man Kwon, professor at the School of Public Health at Seoul National University. My lecture will examine the health policy responses to a pandemic, this COVID-19, and what the Korean experience can give the lessons for other countries. It's more of a policy perspective rather than a clinical perspective on this policy. So this lecture will examine the key characteristics of the Korean policy response to the COVID-19. And for this policy preparedness and also very rapid and flexible response to this pandemic is a key success factors. And also Korea had a national health insurance covering everybody, every citizens. And this is another very important policy that enables and guarantees access to the necessary healthcare for every Korean. So these are the structures of this course. First, some basic epidemiology of this pandemic, and then I will examine the key aspects of the rapid and flexible response to pandemic. And then I'll examine governance issues and national health insurance and with the universal health coverage. And also I'll examine the healthcare delivery. And I'll conclude this lecture by examining what are the key remaining challenges and policy lessons for the countries. So this course has an objective, three objectives basically. The first, to learn the key success factors of the Korean response to COVID-19. And second, we discussed the lessons from this Korean experience for other countries. And third, we also examine the remaining challenges facing Korea in this response to COVID-19. So this is a basically daily number of confirmed cases. You can see that there's a huge infection in early, middle March, and then very stable trend of the new daily cases, which means that Korea has been successfully controlling this pandemic after the March crisis. And we can compare this with other countries. Well, the United States is a rather kind of outlier in terms of the number of confirmed cases. It's very high. Whereas the other countries, the United Kingdom, Italy, Germany, Turkey, China, they are all much higher number of COVID-19 cases compared to South Korea. You can see that in this figure, the Korea is a bottom. So compared to other countries, the Korea's total number of COVID-19 cases right at the bottom. I'm not sure whether you can see clearly, but it's the bottom part of this figure. You can see that the total confirmed COVID-19 cases of Korea. So what are the key elements of the Korean response? I would say the most important part is a rapid and flexible response to this COVID-19. Then what made this type of rapid and flexible response possible? The most important factor, I think, is a preparedness. So in other words, Korea is prepared to cope with this type of pandemic crisis. And for that preparedness, that the policy lessons or experience from the MERS. MERS is the Middle East Respiratory Syndrome that Korea experienced about 5 years ago. So we had a painful, in a sense, painful experience of many casualties and infections at that time as a result of MERS. But Korea successfully learned from this the last policy experience. And after the MERS, the Korean government strengthened the Korean Centers for Disease Control and Prevention. And also we introduced a very aggressive contact tracing system. So contact tracing means that when there is a patient, you have an interview with the patient, and also we collect information from credit card use, mobile phone location, and also CCTV. So Korea revised the law, and that law enabled Korea to adopt this type of rather aggressive contact tracing. And also there is a very good cooperation between central and local government, because as you know, this is infectious disease, and infectious disease cross the borders of local government. So if each local government has its own policy without good coordination with other government, other local government or central government, we cannot effectively cope with this corona or pandemic crisis. So after the MERS crisis, Korea also learned that cooperation between the central government and local governments are quite important. And also we learned that testing is very important. So as a result of this very rapid response and preparedness, Korea was able to flatten, so-called flatten the epidemiological curve and reduce the number of infected cases at the early stage of this pandemic. And as a result, we are able to avoid the overburdening of the healthcare system. So these are so-called 3T policy in Korea: test, trace and isolate the confirmed cases, and treatment. Okay, we should treat the patient. And also in this whole process, the first phase, like testing, is so important. So Korean government approved the test kit at a very early stage. You know, like early February, Korean government already approved the test kits. And this type of early detection, isolation, and contact tracing, and also in the whole process, information and communication technology played a very important role. Because this COVID-19, one of the unique aspects of this COVID-19 is that there are many asymptomatic patients. I mean, even if, say, suppose I'm infected, but I have no symptoms. So I don't know whether I'm infected or not, because there are many patients who don't have any symptoms. So because of this uniqueness of COVID-19, very early stage interventions by testing is very important. Because testing, we can easily early identify the infected cases and isolate them, and we can stop this case infecting others. Okay? So this type of 3T policy was an important aspect of the Korean response. And thanks to this type of preparedness and 3T, Korea successfully coped with COVID-19 without major lockdowns. As you know, in the US and many European countries, they had to introduce a major lockdowns. But in Korea, we are able to control the number of infected cases without relying on any major lockdowns. So this is the total number of confirmed COVID-19 tests. So as I mentioned, mass-scale testing from the early stage was a very effective strategy to detect and isolate the patient. And you can see Korea, this is the test. It shows that Korea had a very, at the later stages, many other countries, joined. And they also adopted a large-scale testing. But in the early stage, up until mid or late March, Korea has the largest number of tests for the COVID-19 the cases. So, and another aspect, in addition to the preparedness, is flexibility, or so-called adaptability. Because this is a new epidemic, and we don't have enough, or we don't have sufficient scientific evidence at the beginning. So with the development of new evidences, we should be ready to change our policy, and also we should be ready to learn from the failures from past policies and rapidly modify the existing policies. So this type of adaptable or flexible response is very important. So in that sense, Korean government is quite successful by introducing a flexibility and quick learning based on the new evidence and also based on the success or failures of the previous policy measures. For example, Korea had a mass-scale testing for so many people. That means this type of mass-scale testing obviously resulted in a large number of confirmed cases. So at the beginning, we sent those all confirmed cases to the hospitals. But later on, we realized, and new scientific evidence showed that there are many mild patients, not severe patients. About, say, 80% of those confirmed cases are mild, not severe cases, such that these mild patients, they don't need hospital care. Okay? So at the beginning, we sent all the patients to the hospital, and hospital beds are full. So later on, we changed the policy such that we classify patients based on the severity and send only the severe patient to the hospital and send the milder patient to the intermediate care facilities, so-called living or residential care facilities. So this type of flexibility is very important. So we call it triage systems. It's a patient classification based on their severity. So next, another important success factors in Korea response is the governance. So good governance is an important factor. There are several elements of good governance, such as transparency in communication. This transparency in communication contributes to the people's trust in the government. So political leadership and also technical or scientific support by a leading technical agency such as Korea Center for Disease Control, they all help the people, the public, to trust the government. And also this is part of the social capital and trust, because one of the most cost-effective approach to a pandemic or COVID-19 is a personal hygiene, wearing a face mask, hand washing, or social distancing, voluntarily canceling meetings. All these things rely on the voluntary participation of the people. So people are more willing to comply with government guidelines, more willing to join this type of social distancing when they trust the government and when the society has a higher level of social capital or social trust. And also, although pandemic of COVID-19 is a disease, but to effectively cope with this infectious disease, health sector, health policy alone is not enough. We should work with the Ministry of Finance, Ministry of Education, Ministry of Interior. So cooperation of multi-sectors or multi-different ministries are another very important success factors for the COVID-19. And Korea has a national health insurance system. So every Korean has a health insurance card. That means there's a very low financial barrier to the access to care. So when the patients are treated in the hospital or in the living treatment centers, it's free. The majority of the cost is paid by health insurance system, and also co-payment is paid by the government budget, and also the testing. There's little financial barrier to the testing, such that in most cases, testing is free. So no cost, free access is a very important factor. And in the case of Korea, national health insurance is a public insurance covering every citizen, plays an important role in reducing the financial barrier to testing and treatment. And also, national health insurance system went further to help the government to respond to this COVID-19. For example, this is a new disease, so we need a new medicines, pharmaceuticals, new services. So health insurance system rapidly expanded the benefit packages or service coverage to include this type of new services and new medicines. And also, health insurance system exempts the health insurance premium contribution for those who live in a heavily affected areas. In the case of Korea, in March, there's a huge infection in Daegu, Gyeongbuk area. And then, this health insurance system exempted the premium for those who live there and who are heavily affected by this pandemic. And also, in the early stage of this pandemic, people are reluctant to use hospitals because they are afraid of being infected. So there is a huge reduction in the number of patients who visit hospitals. So many hospitals experience some financial difficulties. So to help those providers, this national health insurance system also provided so-called advance payment, okay, to rescue fiscally those hospitals. And other one is that in Korea, the majority of hospitals are private. So working closely with these private providers is very important. And also government introduced a rapid response in the health service utilization. So for example, many hospitals, government introduced a separate paths because, okay, this path is for those who have a respiratory symptoms, right? Because COVID-19 has a respiratory symptoms. So if those people with respiratory symptoms are mixed with other patients, there might be a potential infection. So many hospitals introduce a separate treatment paths for respiratory symptoms and those without respiratory symptoms. And also telemedicine was introduced because people are reluctant to visit hospitals or physician clinics. So in the case of more than 2 visits to the hospitals or clinics, we introduced a new kind of a temporary measures such that people can call the physician clinic and get a medicines and prescriptions. So this is so-called non-face-to-face consultations or telemedicine was introduced to improve the access to healthcare. And also, as I mentioned earlier, the allocation of a patient based on the severity, such that very severe patients are sent to a tertiary care hospital, slightly less severe patients sent to general hospitals, mild patients are sent to living treatment centers, and those who don't have any symptoms, they can even stay at home. So this type of rapid response in terms of the healthcare delivery is another important success factor. But although, so I already so far told you that Korea did quite well in the preparedness and also in the response to COVID-19, but that does not mean that Korean response was perfect. Still, we have some remaining challenges. For example, as you know, this COVID-19 affects the older people a lot. So there are many very high level of fatality, mortality from those older population. So there are some cases of high level of infections in elderly care hospitals and elderly care facilities. So it was quite unfortunate, but quite common in other countries. So how to protect the vulnerable population, such as older people, were one of the major challenges in many countries, including Korea. And also another vulnerable population is the poor people, daily workers, because some people, if they have some symptoms, they can stay home, they can work from home. But daily workers or those working in the delivery services, they are afraid of job loss. They have a very insecure jobs. Okay? Or sometimes those who are working at the call centers. So there are some cases of infections from the workers in this vulnerable industry. So how to protect this vulnerable sector is another challenge. And also, because during this pandemic COVID-19 crisis, oftentimes schools were closed and school classes were converted into internet-based classes. But when school is closed, it has a negative impact on the human resource development. And we are worried that when the school is closed, when the classes are based on internet-based classes, there's increasing gap in the academic performance. For example, from a better off household and poor households. There might be increasing gap in academic performance. So there is another challenges for us. So other factor is the public hospitals. Although all private hospitals in Korea join this system, but still we rely mainly on public hospitals because hospitals are not very willing to treat these COVID-19 patients because there might be potential infections. So that's why most private hospitals, although they did treat COVID-19 patients, but they are a bit reluctant to treat all those COVID-19 patients. So that's why the role of public hospitals is very important. And another factor is the contact tracing. Although the very aggressive contact tracing in Korea is based on law, so there's a legal basis, but still there are some potential concerns that this type of very aggressive contact tracing and disclosure of the result of contact tracing to the public. Some people are worried that this type of information disclosure potentially threatens the privacy of a citizens. So, to wrap up, I think that the preparedness as a result of MERS 5 years ago and also rapid and flexible, adaptable response following new evidence was a very important success factors. And in addition, there's a good governance plus universal health coverage based on the national health insurance system covering everybody. Effective organization of healthcare delivery was another important factor. But still, we have remaining challenges, including the protection of the vulnerable population, how to strengthen the role of the public hospitals, public providers, and some potential concern on the privacy issues in the aggressive contact tracing and also the disclosure of the information from the contact tracing. Thank you very much.